Thank you very much for the opportunity to participate in this community education module about bipolar disorder. I have both a personal and professional interest in this condition. I'm a youth mental health advocate, but I'm also someone who's lived with bipolar from the age of 16. In this module, I'll be interviewing Associate Professor Liz Scott, a psychiatrist who is an expert in mood disorders. I'll be asking her questions about the causes, the diagnoses, and the treatments for bipolar disorder. We'll also be hearing from another young person about his experience of living with bipolar disorder. Everyone experiences ups and downs in their moods, and sometimes we describe ourselves as hypo or manic, but I know from my own personal experience that bipolar disorder is very different to that. Liz, firstly, could you give us some information about bipolar disorder, and in particular, how it's different from people's normal mood changes?
Firstly, while bipolar disorder can run in families, there is no single gene for this condition. In fact, there are probably multiple genes involved that interact with factors in the environment to trigger the condition. So this explains why the spectrum of bipolar disorder is so wide and varies from mild symptoms with a minor impact on a person's life to more severe episodes of illness requiring hospital admissions. Secondly, bipolar disorder is described as a mood disorder, but really it's a disorder of energy and drive. The best way to describe it is by thinking of the clock that sits in our brain. This brain clock sets our sleep and wake times and regulates the amount of activity we do. Our brain clock is set to wind down our activity at night, switch on sleep, and then wake us up in the morning so that we can be active during the day. This clock is our master clock, and it sets all our other body clocks, and I'll come back to this later. In bipolar disorder, the current evidence suggests that this clock is faulty. When people are in a low mood or depressed state, they feel tired and lethargic most of the time. They report that they feel slowed down, and it's an effort to get out of bed and do things. In this phase of the illness, people find it hard to get up and go to work, study, or socialise. They often sleep a lot during the day and sometimes find it hard to sleep at night. But no matter how much they sleep, they feel tired. In this state, people can feel very low and depressed. In severe episodes, people stop enjoying activity, socialising, or relationships. They may feel worthless or hopeless. They may also feel that life is not worth living, and suicidal thoughts are common. Sometimes people can feel very agitated or irritable with friends and family members. In some cases, in what we term bipolar I disorders, people may develop some unusual beliefs or even hallucinate. These psychotic type symptoms usually reflect the underlying mood. For example, a person may feel extremely guilty and believe that they've done something bad or wrong for which they're going to be punished, or they may hear voices telling them that they're worthless or bad. These episodes of low mood and energy or depression can last for a very long time.
I know that in addition to episodes of low mood, I've also had times where I feel really productive and confident. I have a lot of energy and a lot of ideas. And at those times, I don't need much sleep. Everything seems to be going really fast. Sometimes I get irritated with people around me if I feel like they're moving or thinking too slowly.
So Rachel, that's a really good example of a hypomanic episode. Hypomania is not just feeling really excited or happy for a few hours or days. It's a state of sustained increase in energy or drive. A person doesn't necessarily feel extremely happy in this state. Often people can feel quite irritable and argumentative. They can be impatient, restless, and reckless. In a hypomanic or manic state, a person may take risks that they wouldn't normally take, such as driving fast, drinking more alcohol or using drugs, spending money buying things they don't really need, and taking more risks with social activity or sexual activity. During this time, a person often sleeps less but doesn't feel tired, eats less, takes less care of themselves. They can often speak fast, jump from subject to subject, and find it hard to organise themselves. They'll often start tasks and not finish them as they get distracted by something else.
What's the difference between hypomania and mania?
That's a really good question. So hypomania is a less severe form of mania. When a person is manic, the increase in drive and energy becomes so extreme that a person often has very little sleep and can't function in their usual roles. In a manic phase, a person usually has no insight into their condition. That is, they don't know that they're unwell. Unusual beliefs are common and reflect their mood. If their mood is high, They may have grandiose delusions and believe that they're rich or famous or they've got special powers. If they're irritable or agitated, they may feel more paranoid and believe, for example, that people are trying to hurt or harm them. In a manic state, a person would generally need to be admitted to hospital for urgent treatment and to prevent harm to themselves, and in some cases to others.
Liz, how do you treat bipolar disorder?
As with most medical conditions, early intervention is critical. Bipolar disorder usually starts between the ages of 16 and 24. So if we can identify young people with unstable mood and other risk factors for the illness and treat them early, we think that this can make a big difference. Sadly, in many cases, a person will have been unwell for many years before a diagnosis of bipolar disorder is made. Early treatment involves improving sleep and activity patterns, helping people to maintain regular exercise and social routines, reducing and managing stress, and recognizing the triggers for episodes. Sleep deprivation, change of season, life events, drugs and alcohol, infections or travel can trigger an episode. So helping people to identify and manage their personal triggers is critical. The holistic management of bipolar disorder includes behavioural and psychological therapies, medication and family carer support and education. Behavioural therapies include sleep-wake cycle or social rhythm therapy with structured exercise and social activity. Psychological therapy includes cognitive behavioural therapy for management of anxiety and low mood, and what we call dialectic behavioural therapy to help with mood regulation, stress management, and help with impulsive or suicidal thoughts.
So Liz, tell us what kind of medications are used to treat bipolar disorder.
So most people will also require a mood stabiliser at some stage to help them manage more severe episodes and prevent a relapse of symptoms. Lithium is a common treatment. It has a direct effect on the brain clock. Other medications used in the treatment of seizures disorders are also used as mood stabilisers, such as the anticonvulsants lamotrigine and sodium valproate, or the antipsychotic mood stabilisers. These medications may be used alone or sometimes in combination. Antidepressants are used to treat depression, but they are almost never used on their own. Without a mood stabiliser, antidepressants can cause hypomania or unstable agitated mood, called a mixed state. As the brain clock regulates the other body clocks, people with bipolar disorder frequently experience other medical problems relating to their body clock. These include weight gain, obesity, high cholesterol, heart disease or diabetes, hormonal or immune problems. These medical conditions need to be monitored and managed, and medications used for the treatment of bipolar disorder should be chosen with great care to avoid making these problems worse. People with bipolar disorder are also more likely to misuse drugs or alcohol, particularly during episodes of illness, causing other medical and psychological problems.
From my own experience, I know how important it is to take care of my mental health because it affects every part of my life. Most importantly, I know that I need to make sure I maintain good sleep so that I'm not sleeping too much or too little, but also that I'm going to sleep and waking up at the right time every day. It's also really important that I keep a regular diet and exercise. Now, this doesn't mean being strict or excessive. It simply means keeping regular meals and regular activity because this helps regulate my mood. And every day, I make sure that I take some time out for myself. It helps to check in and see if I can recognize any warning signs. But I also use this time to do something nice for myself and remind myself why taking care of my mental health is so important. Liz, is it true that there have been many famous people with bipolar disorder?
So yes, the evidence suggests that people with bipolar disorder often have high IQs and high levels of creativity, that they're able to see and think about the world in ways that other people can't. They can also be extremely productive. You only have to watch the documentary by Stephen Fry, The Secret Life of the Manic-Depressive, to see this in action. So bipolar disorder can be both a burden, but also a gift.
Thanks everyone for participating. If you'd like to learn more, please visit Origin Youth Health, Beyond Blue or the Sane Australia website.